We are going to study about shock and the types of shock. Shock is defined as it is a state of circulatory inadequacy with poor tissue perfusion, resulting in a generalized cellular hypoxia. In simple definition, when there is a circulatory compromise, it results in a poor tissue perfusion, which results in hypoxia. Simple. There are types of shock. One is cardiogenic, one is hypovolumic, other is distributive, fourth is obstructive. Cardiogenic, when there is some problem with the heart. So obviously the cardiac index will be less, but the systemic vascular resistance will be increased. There is no problem with the peripheral vascular resistance. When there is problem in the heart, the SpO2 will be reduced, the right atrial pressure will be increased, right ventricular pressure will be increased, but the PAP will be also increased, and the pulmonary obstructive pressure will also be increased. In hypovolumic shock, there is loss. So when there is loss, there is no blood, so the cardiac index will be less. The peripheral vascular resistance will be normal, but the systemic, the heart will try to pump more, so SVR will be more. So SVO2 will be less. There is no problem with the heart. So SVO2, obviously when the circulation is less, so the SVO2 will be less, right atrial pressure will be less, RVP less, PAP, POP will be less because there is no problem with the heart. When there is distributive shock, example, if somebody had a P-bite, septic shock, then it is a distributive shock. The cardiac index can be normal or can be increased. The SVR will be less, but the PVR will be normal, and the SVO2 will be normal or increased, RAP will be normal or decreased, RVP will be normal or decreased, PAP will be normal or decreased, and same with the PAOP. Obstructive, when there is some embolus, so obviously there will be less supply to the heart, so the cardiac index will be low, the SVR will be increased, the PVR will also be increased, and the SVO2 will be decreased, the RAP, the pressure on the heart will be increased, so the RAP, RVP, PAP will be increased, but the PAOP can be normal or decreased. Thank you.